Hello, everyone. Today, I have the pleasure to speak with a dear friend of mine, Ray Cralle, one of the pioneers and leading physical therapists specializing in hyperbaric oxygen therapy. Ray was actually recently elected to the Veterans Hall of Fame here in Florida, and he runs Hyperbaric Oxygen Therapy Center in Delray Beach, where he focuses on treating different traumatic injuries, anywhere from PTSD, stroke, autism, and also sport-related injuries. Ray, welcome, and thank you so much for giving me the time to speak with you today.
Well, it's always a pleasure, Barbara. It's good to see you again.
Tell me, Ray, a lot of people don't know what hyperbaric chamber is. You gave me the opportunity over 10 years ago to actually have 20 dives, so I felt rejuvenated. My alertness, my energy went up, even though I'm a healthy individual, but always on the go and stressed out. Let's start today for our listeners, what really hyperbaric chamber is and what are the benefits of utilizing hyperbaric chamber?
Well, the chamber is, as the word sounds, it's a tube that has two metal ends and a transparent plexiglass sort of thing so that it's not so claustrophobic, and it allows us to put oxygen under pressure. So when you do that, the mechanics of putting oxygen under pressure means that we can far exceed anything you can get from breathing oxygen through a mask, like you might see athletes sitting on a bench in the middle of a game breathing oxygen through the mask. You can only get the oxygen that you have red blood cells. But when we put you in a chamber and put that same gas under pressure, we can far exceed the lungs' abilities, because now, because of the pressure, we can push the oxygen into the water of the blood, the plasma. So it's the plasma oxygen concentration that goes up. And most people, most hospitals are using this to treat non-healed wounds, like diabetic wounds that used to be amputated are no longer amputated, because by increasing the plasma oxygen, we can heal those wounds that used to be very much a big frustration, not only to the patient, but to most of the medical staff, including the cost of doing that. So that is the first simple thing about oxygen. The second thing is, when you do put oxygen under pressure, the amount of pressure that you have is related to how much oxygen you push into the water of the blood. Mm-hmm. And so when we're treating, we're trying to keep in mind that pressure is as much a part of the treatment as is the gas itself. So when you mentioned COVID, well, people die of lack of oxygen with COVID. That's how you die. You die of hypoxia. And that can't happen when we can far exceed the lungs' abilities by simply filling the body's requirements for oxygen by doing it by increasing the oxygen in the plasma. At a sick wound site, like a diabetic wound, we can increase the oxygen at a really terrible wound site like that up to 2,000%. So that's number one. Number two, when you do 20 treatments at 2 atmospheres of pressure, there has been proven to be an 8-fold increase in your own stem cells. And so your stem cells are what you were born with, and God gave us those as our little healing kit. And of course, if we're unlucky with a bad genetic inheritance, or if we've had accidents and fractures, and if we have had any type of anything that is going to cause our body to want to repair itself, these stem cells are called upon. So we can deplete the stem cells rather rapidly. And as we age, they really go down very rapidly. So by increasing the stem cells, we have a significant impact on the body's ability to heal. But the oxygen also upregulates the innate immune system as well as the adaptive immune system. So with COVID, the adaptive immune system is what happens to those people that contact COVID and don't get really sick. Their immune system adapts to it. Now they have the antibodies, which is in my mind, the preferred way of taking us away from COVID. And I personally have treated many COVID patients. I was part of a team that went into a hospital in Sioux City, Iowa, where we deliberately selected the sickest of the sick COVID patients. We took 20 intubated patients, which means that you have an 80% chance of not living. And 19 of these people went home after only 5 hyperbaric treatments at 2 atmospheres of pressure. So most people don't know that this is available to them. And if you have the very beginnings of COVID, or the other part of it is some people end up with what are called long hauler symptoms, meaning that they have mental confusion or they have weakness or other issues because the virus doesn't completely leave them. And so they have these long hauling symptoms. And those are very responsive to hyperbarics as well.
So tell me, because people are probably slightly, interested, what are the differences between the ventilators that are being used in the hospital, right, for the patients with COVID versus the hyperbaric chamber? Because people need oxygen and both of them apparently do the same, but I know that there is dramatic difference.
Well, there's a huge difference because the ventilator is not necessarily carrying pure oxygen, and basically the purpose of a ventilator is to use pressure to cause the small little sacs in the lung, the alveoli, to expand and allow you to have more surface area for transfer of oxygen. And that's in people that are really desperately ill with COVID because their lungs are full of fluid. And that happens because of the infection at the lung site. So and you can actually damage lungs if you're not very, very careful doing and intubated. Intubation is a very difficult thing to be dealing with and oftentimes really damages the lungs of these people. Oxygen under pressure, on the other hand, it doesn't really affect the alveoli. It doesn't cause them to be under a great deal of stress. For instance, we can take very sick lungs, like in COVID, in people with COPD, their lungs have lost their elasticity. And so these people can't, their tidal volume or the amount of air they take in and breathe out is really reduced. And this is why these people fatigue so easily. They can't walk very far without getting breathless, that type of thing. So oxygen, the way we deliver it, the oxygen is simply being pushed because of the pressure that is in the chamber. And that pressure is throughout your entire body. So that way we can cause the patient with COPD to go under pressure, but we can't give them as much pressure as we would a person with healthy lungs or more elastic. So oftentimes those patients can benefit from hyperbaric oxygen, but they'll require more treatments at a lower pressure than if we were able to put them at a higher pressure.
And Ray, correct me if I'm wrong, but I believe the Chinese also adapted to exactly utilizing hyperbaric chamber, right, oxygen to treat their COVID patient. And
in China, they did do that, yes.
That, right?
Yes, not only China, but other parts of the world now are using it. And more places here in the United States, in Connecticut, I know they're doing a study at a hospital. In the west side of Florida, there's a hospital looking at this, and there was a small rural hospital in Louisiana who learned of our work, and they took 5 intubated patients, and all 5 went home after five treatments of hyperbarics. So it's quite effective on eliminating the scary part that people are so much afraid of. And of course, the mask has always been a joke because the virus is so small that the mask has no possible way of stopping you from breathing it, number one. And number two, the primary use of the mask is if you are very symptomatic and coughing and sneezing, then these little micro droplets that you would sneeze out, it will capture that water-like material. But if you're not sneezing and coughing, you're not going to be, that's not how the virus is being transmitted.
Sure, that makes sense. So tell me how oxygen therapy, the hyperbaric oxygenated therapy, and nitric oxide, what do they have common when you look at the oxygenation therapy?
Well, the most important part of hyperbaric oxygen is to the diabetic patient, because the diabetic patient's endothelium, or the lining of the artery wall, doesn't allow them to get access to their own stem cells. So the diabetic patient, they go blind, they have all these horrible wounds, And so we know within 5 treatments of hyperbaric oxygen, there is a nitrous oxide synthase reaction on the artery wall that allows that artery wall to open up. So not only can we push the oxygen to the sick wound site in a diabetic patient, but now they have access to their own stem cells. And the other part about oxygen with vascular problems, people that have clouded arteries or clogged arteries or atherosclerosis, is that the plasmagens, which is what is sticking on the inside of the artery wall, are washed away with hyperbaric oxygen.
Tell me, are there any objections that someone would, have not to utilize hyperbaric chambers?
Well, if you have extremely high blood pressure, we can't put you in the chamber, because when you breathe oxygen under pressure, the artery constricts, and that would increase your blood pressure. So we're always monitoring blood pressure. So that's the one concern. And people, the main incidence of care about giving oxygen is pressure on the ear. So you can damage the eardrum from pressure, but if you can fly in an airplane, or if you can skin dive or scuba dive, that shouldn't be a problem. About 2% of the population have to have an ENT either take a very, very fine needle and puncture the eardrum, or they go inside the mouth into the eustachian tube and they put like a stent in there so we can equalize, but that's a very rare thing. And you'll also hear people talking about oxygen toxicity. Yes. But I treat a lot of veterans, as you know, and I treat Navy SEALs, and the SEALs will tell you, the wet ones, the ones that are actually doing the diving, will tell you that you have to be at 2.88 atmospheres of pressure and swimming to have an oxygen problem. If you're laying peacefully in a hyperbaric chamber, watching movies or listening to tapes or television channel, and you're not exercising, it's almost impossible to have an oxygen toxic event in a 90-minute treatment, which is the typical time that we put people into the chamber.
Yes, I want to make sure people understand, Ray, because when I did hyperbaric chamber with you, like I said, over 10 years ago, and I suggested that treatment to many professional athletes that I had the pleasure to work with, I tried to explain to them, and they listened to you better than to me when it comes to that. They understood the difference between the sleeping bags chambers, right, versus your medical chamber. For the listeners, explain the difference in the pressure and what the medical can actually achieve versus the sleeping bags, the way less of a cheaper, products that are on the market and confuse people.
The canvas bag chamber was approved for mountain sickness. People that want to go skiing and it's a new thing to them, and they start going up at their mountain and their lungs start filling up with fluid and they can die. So you put them in the bag, hyperbaric, it's a canvas bag that they inflate with air, and then the oxygen is delivered with a mask, and they can get you down off the mountain. But the pressure, you cannot get the pressure in a bag chamber. It only allows you to have very low pressure, but it can save your life in an incidence where you're undergoing mountain sickness. So that's where that came from. The other thing about hyperbaric oxygen that makes it very powerful is the anti-inflammatory effects of it. So October the 7th of last year, 2019, or 2020, the Nobel Prize in Medicine was oxygen in the cell. And they have found that almost every disease that you can think of, or the CPT codes that your doctor uses to describe a disease, is really a description of inflammation in the body. And so oxygen is known to shut down inflammation, whether that's a sprained ankle or a broken bone or a pulled tooth, or we have a massive influence on inflammation. So that's one of the major uses of it. And we have found in the world of sports and NFL concussions, as well as veterans suffering concussions to the brain from blast exposure, that if we catch them within 5, preferably 4 days of a concussion, we can totally heal the brain with only 5 hyperbaric treatments. When you have concussions that have been compiling over and over, like a football player would, then you get something called chronic traumatic encephalopathy, and that's a disease process in the brain, and we can really help those people as well. but it takes many more treatments. Usually 40 is the typical treatment for something like that. So I work with NFL ball players, as you know. I work with other kinds of athletes as well. And we help people overcome surgeries faster than usual, that kind of thing, because of the anti-inflammatory effects of oxygen.
You know, when you look at the brain injuries, and I want to take a moment here for the sake of comparing the brain injuries you've dealt with, because I know that you've dealt with NFL and I know you've dealt with our veterans. Does it take a similar exactly amount of the dives, I think you would say around 40, to really heal the brain from PTSD and from the concussion? Are there any similarities in the treatment? Do you have to go higher? Do you have to go lower?
Well, the issue, Barbara, is how many concussions have you had?
Got
and
it.
how, and what's the chronicity? How old are they? How long ago? And how, so if you've been playing Wonder League football all the way up into the professional levels, you've had an awful lot of head trauma. Mm-hmm. And so those are going to require usually 40 treatments. In Israel, they treat 2 months, they treat 60 days. But in our country, 40 is a dose that basically covers most issues. There are cases that I treat with more severe brain injuries where we have to treat many more times. So
what would it take for one to get a treatment? What treatments are covered by our insurance and which one are unfortunately not?
Well, there's 13 conditions that Medicare and insurance will pay for, and you don't want any of them. They're very, very bad things like radiation necrosis. So if you've had mastectomies or cancer, if you've had radiation necrosis from cancer of any sort, the typical treatment is to order hyperbaric oxygen, because the radiation not only kills the bad guys, but it starts burning tissue that you don't want it to burn. So they often then will send the patient to us for hyperbaric oxygen, and insurance, most all insurance companies will cover that if you catch it soon enough. It has to be within the last 6 months of the last radiation treatment. It can't be that you had radiation 5 years ago. They're not going to cover that. But so compartment syndrome fractures, where you lose blood flow to, say, the end of an extremity, you've broken your wrist or your ankle, and you've also disrupted blood flow. We can keep that tissue alive until they're able to reestablish circulation. So those are very difficult kinds of things. But in general, a lot of the work that we do is so-called off-label. We treat stroke, we treat Alzheimer's, we treat vascular dementia, we treat near-drowned children, athletes, post-surgical things, and of course, they've just recently published a study that I'm excited about in Israel, where they have took a number of patients with different ages and different problems and treated them for 3 months, 5 days a week at 2 atmospheres of pressure. And they found a 20% increase in the length of their telomere. Wow. The telomere is the tail of your chromosome that is related to how long you're going to live or how long a cell can divide. So the older you get, the shorter the telomere until, Father Time wins. So there's the anti-aging crowd is very excited about that particular research. And I've always suspected it because many of our patients, so many of our veterans, 25 a day, are killing themselves. And I was one of 2 centers in the state of Florida approved by the state to treat veterans with blast brain injury. I've been doing it anyway for some long period of time.
Since I remember, since I know you, you have been doing that.
Yeah, we've just recently completed a study that's going to be sent into our state legislatures for them to consider offering this to veterans who are suicidal, who have gone away as a young man and come back a very, very old man. And they have so much damage in their brain. They can't control their anger. Many of them are drinking and drugging. They scare their families. And so not one veteran that we've treated has ever attempted suicide again after we've treated them. So that's been a real, and of course, I'm an old Marine from the Vietnam days. So I saw too much of this myself, and it's wonderful that we now know that we can do something about it. So this is growing in popularity. The Senator Tom Wright here in Florida passed a bill so that there was some funding for myself and Dr. Eddie Zant to do some testing on this to prove to our legislators and others that veterans don't have to be so mistreated when they come back from being in service for so long.
Has that been already done, or COVID kind of slowed down the process and you are in the midst of it?
Well, we have completed there was a limited amount of funding, so that allowed us to treat a limited amount of veterans. And so the thing will be that they're going to follow these veterans for 6 months and a year, and they have a testing that's going on through the University of South Florida. And that all that information will show it wasn't just a Band-Aid, that it had longer lasting effects and permanent effects, as I know that, for I've been doing it that long.
Fantastic. So, Ray, besides your facility in Delray Beach in South Florida, where else people, especially in Florida state, could go and utilize hyperbaric chamber?
Well, first of all, you have to have a prescription because oxygen under pressure is considered a drug. So you can't just go. It's like you can't get it like buying ice cream or buying something from the health food store. It is a medical procedure. And so there in the United States, there's estimated about 240 centers that are outpatient centers that will do off-label work. A hospital will not treat a stroke with this, and yet we have huge amounts of evidence showing that we can have major effects on stroke and helping recover the brain even 12 years after a stroke. So this is stuff that most people don't know. Treating MS and other types of autoimmune diseases has a major effect on things like lupus and other situations like that. So in Florida, I don't know, there may be 3 or 4 outpatient centers. I don't know, in the country, it's estimated there's 240 centers, and not all of them offer rehab, which we do. That makes us a little different, because if we can fix you and then we can also do the rehab, it all kind of goes together and helps you to get better quicker. So.
Of course, and you are one of the very few people actually in the entire US doing the myofascial release that you do along the entire spine and organs, and I know you combine the therapies together. I've utilized it. I'm very grateful for you to exactly perform the work on me so I can stay in peace with myself, and I think a lot of people will benefit from the therapies. So I will make sure that once people are watching and they understand where they can find you. If you guys want to learn more about hyperbaric chambers, like I said, Ray Cralle is the pioneer and the key person who has extraordinary knowledge, experience, and absolute fantastic results. And results are everything that we always look for. And he is the man to get educated by and get the services from. So look out for Ray Cralle at Delray Beach, South Florida, and get additional information if that was not sufficient. But I hope that you've gained valuable information how hyperbaric chamber oxygen can not only help you during the COVID time that we're all facing, but also anytime to strengthen your cardiovascular, immune, and your nervous system. Ray, would you like to add anything else?
Well, I think that pretty much covers everything, Barbara. I think nutrition also plays a very important role. Besides what I'm doing, nutrition is something that's very, very necessary to help people overcome a lot of things. And I know you have a product out there that I think is, that I enjoy. The drink that you make, it kind of goes along with what we do. Supplementation is important to understand, and you know, diets, for instance, in cancer, we treat cancer patients, and so they know that oxygen kills one of the kinds of sugars that cancer feeds off of. But the other type of sugar that cancer feeds off, you have to be on a ketogenic diet. And so, you know, we work with cancer doctors and patients. We add that part. Our oxygen makes the radiation and chemo work better. But supplementation and some of the things that you're producing yourself is a valuable asset to the welfare of patients. So. And you're the expert in that area.
Well, thank you. I appreciate it. I always surround myself with experts like yourself to learn more, to help understand the science, because science is powerful and it tells us that oxygenation, nitric oxide are very valuable, powerful molecules that, like you said, we can absolutely support with oxygenation from the hyperbaric chamber, but also there is nutrition that we understand can be powerful for the entire body as well. And usually plants become very handy when it comes to that.
I agree.
Thank you so much, Ray, for your time, for your passion, and for everything that you do. I'm one of many, many people that is very grateful for everything that you bring to the industry.
Well, thank you, Barbara. Been
Thank
a pleasure.
you. Wonderful day, and I will speak with you soon.
Okay. Have all the best.